Welcome to our CXO interview series, The Journey to Digital First. And I'm joined here today with Brad Newton, the CIO of North Memorial Health. Brad, welcome. Really excited to have you here today.
It's good to be here.
I know we've got a lot of content to cover, so let's go ahead and get started. So, Brad, I know you're relatively new to North Memorial Health. Can you start off just by providing us an overview of your roles and responsibilities within the organization?
Sure thing. So North Memorial Health is a nonprofit health system in the Twin Cities area of Minnesota. We serve our customers through 2 hospitals, about 30 clinics, and as Chief Information Officer, I'm responsible for the information technology vision, strategy, security, and day-to-day operations for those customers, as well as for our internal team, as well as for about 10 independent clinics that have outsourced some or all of their IT to North Memorial.
So, Brad, what do you personally see as the critical enablers for a successful digital transformation?
So there's a few things that come to mind. The first is culture, and having a core value of inventiveness is a good start. But we also need a culture that doesn't have much tolerance for friction. So a strong desire to make everything easier built into the culture is the first critical ingredient. The second is talent. So we need a group of people within the technology organization that keeps the lights on and continuously improves how we do that, that helps us avoid the distractions of unplanned work. We need another group of people within that talent pool that's focused on innovation and creativity and always looking for ways that we can implement workable solutions to improve the experience for our team members and our customers. The third is instrumentation. So traditionally within IT, instrumentation is focused on the flashing lights that let us know how healthy our systems are. We also need instrumentation that tells us about the value of these systems, that helps us realize and pivot quickly if one of our projects or systems isn't delivering the value that our customers need.
So, Brad, I know that you are relatively new to your CIO role at North Memorial, but you've got a lot of experience as a TBM leader at your previous company and beyond. I would love to hear your learnings from, a TBM perspective that you've been able to bring with you to North Memorial.
Yes, there have. So as a TBM leader in my last role, I focused a lot on information about our technology and ensuring that the organization understood what they were investing in when they put money into the IT budget and had the ability to make decisions about whether or not they're getting the value out of those investments. In my new role as a CIO, I have an even greater responsibility both for defending that budget, creating that budget, but also working with my colleagues around the organization. These information and technology assets aren't owned by me or my department, they're owned by the organization. So we've got to have great transparency around what exactly are we doing with this investment and are we getting the most out of it that we possibly can. So in my new role, I don't have the data and the analytics that I had in my old role after building a TBM program for several years, but I know what kinds of questions to ask. And I've had many of the discussions already around here's what we can do that will help us extract more value for every dollar of investment that we make in technology.
Great. And so kind of just to hone in on that a little bit more, have you started that conversation around the shift from cost cutting to delivering and driving value for North Memorial?
Absolutely. And as we're looking at, it's hard to find projects that don't involve technology.
Yeah, right. Yep.
So, but for all of these projects, whether they involve my team or don't involve my team, the discipline of asking, so how will we know a year from now if this was successful? What's the value that will be delivered by making this investment is a very valuable set of questions to ask and gets people thinking about, okay, we're not doing this just because it's a fad or just because another health system is doing it. We're doing this because it should have these results for our organization. The other thing that really helps is putting it into terms that make sense to the business. So last year, as everyone was trying to figure out where can we quickly reduce our variable costs? Where can we quickly make cuts? Where I was before, the discussion turned to contractors that were on the service desk. The translation is very, very easy. Yes, we can reduce that spending tomorrow. And it's going to mean that the amount of time that doctors and nurses wait on hold before they can get to someone on the service desk is going to go up. So let's talk about where the value trade-off is. How much time should we expect people to wait versus how much money would we save by reducing the headcount? So having the discussions in terms that are normal business terms makes it a lot easier.
Great, great. So you've really been able to align the work that your team is doing to the goals of the business.
Yes.
That's great.
Yes, we try to have those conversations whenever we can. And
Perfect.
we're fortunate that our published strategy, the strategic goals of North Memorial, some of them focus very specifically on the customer experience and the team member experience.
Mm-hmm.
And both of those experiences are driven these days by technology and the things that we can do to reduce friction in their work. For the rest of IT, sometimes it takes a little bit more work to connect the dots between the work that we're doing every day and what the organizational strategy is. So for those types of work, I go looking for specific examples that we can share through stories. So the work that Charles and Tom did on improving the accuracy of patient data capture by building an interface between two systems that the vendors told us would not interface.
Mm-hmm.
That work, it saved 2,000 hours a year for our rehab team. And the work that
Wow.
Dustin did to rebuild an ETL process that used to take 3.5 hours every single day, he got it down to 20 minutes. And that means that information is available for taking care of patients 3 hours faster every day. It's those stories about how keeping the lights on, it's one or two dots to connect to patient care, but you can always draw those connections. It's worth sharing with the team.
So in your opinion, how have you seen the relationship between you and the CFO and other business leaders at your company evolve? And what do you think that's going to look like in the future?
Yeah, so CIO and CFO relationships are complicated. And from what I've seen in my experience, it's gone from a reports to relationship between the
Mm-hmm.
CIO and the CFO to either a partners with or competes with relationship.
Mm-hmm.
And I think that the competes with is not a stable situation, but competing for resources, arguing about who's going to get the funding, that's not sustainable. What I'm experiencing now, which is fantastic, is working with a CFO who shares the same goals for our health system, which means I also share the goals for our health system.
Yeah.
Sometimes the right investment is not in a new piece of equipment for our data center,
Right.
it's for something that's not technology. But having a team approach where we can understand and communicate clearly about the value of different investment options, whether it's technology or facilities or something else, is a role that our CFO is driving all of us towards for the betterment of the health system.
Very healthy conversations for sure. It's great.
Yeah.
So now let's switch to some fun questions. Done
Okay.
with the serious ones. So I would love to know what TV show you're currently binge watching.
So my wife and I like to binge watch together, which is sometimes a challenge because we have to find something that works for both of us. So while we're waiting for season 4 of Yellowstone, which was one of our favorites
My
year,
favorite.
we've started watching Outlander, which is, it's the #1 series in the time travel romance genre. And
I haven't
halfway
seen
through
it.
season 2, I'm thinking there's not really enough time travel in here to appeal to the sci-fi fan in me, but it's still something we can watch together.
That's great. That's great. I'll have to put that on my list. So I love asking this question, particularly to CIO. What is one piece of technology you cannot live without?
One piece of technology I could not live without, honestly, my Instant Pot.
Oh,
It's
really? I love
an
it.
appliance, I know, but it's technology because
Yes.
it doesn't explode the way my family was worried a few years ago that any pressure cooker might. And it makes it a lot easier for me to fix dinner quickly and have it taste like it took hours to make. So definitely the
That's
Instant Pot.
great. That's a great tip. So if you were on a beach right now, which sounds amazing to me, what would you be reading?
So if I were on a beach, I would probably not be reading a business book.
Right. Don't
I
blame
would,
you.
I get to read a lot of those, but if I were on a beach right now, I would probably be trying to finish up a book I started about a year ago, and it's Quantum by Patricia Cornwell. It's sort of a cybercrime thriller. It's a fun book, but I keep getting distracted by the business books and works, and I just need to get to the beach.
Yeah, you need some vacation, right?
Yeah, exactly.
I love it. Well, thank you so much. I thoroughly enjoyed the conversation today, and really appreciated your time.
Thank you. It's been a pleasure talking with you.
Thank you.